Good afternoon. Thank you for joining us for the Government of Newfoundland and Labrador's COVID-19 update for today, Monday, February 15th, 2021. We are now in day 3 of the latest lockdown across Newfoundland and Labrador, and as we have seen the numbers fluctuate, it's critical that we maintain a heightened sense of vigilance as we continue to contain and try our best to contain the latest outbreak. With that, I'll turn it over to Dr. Fitzgerald for an update.
Thank you, Premier. Good afternoon, everyone. Thanks for joining today. Since the media advisory yesterday, we have 7 new confirmed cases of COVID-19 in our province. We also have 21 presumptive positive cases. Presumptive cases are those confirmed by rapid testing, and we treat these confirmed cases and act on them just as we would a confirmed positive case, especially now when we're in a situation of widespread community transmission. Of the confirmed cases, we have 6 in Eastern Health, all under investigation, 1 under 20 years of age, 1 between 40 and 49 years of age, 2 between 60 and 69 years of age, and 2 over 70 years of age. There is also 1 new case in Western Health between 50 and 59 years of age that is travel related. The total number of cases in our province is now 704. There have been 5 new recoveries since yesterday, leaving 298 active cases in the province. 1 person is in hospital with COVID-19. 1,829 people have been tested since yesterday, for a total of 92,874 tested to date. As I have indicated before, please do not read into these case counts. In public health, it is not the cases we know of that are concerning, but the cases that we don't know about. So a case identified is a case contained. We are increasing capacity in all areas of our response, including testing and contact tracing. We will continue to see cases in the days and weeks ahead. We have worked through our initial priority groups and are now testing more symptomatic people, so we expect more cases there. Public Health and Eastern Health have identified more unlinked chains of transmission, so suffice it to say, COVID is among us. We need to be vigilant. Reduce your contacts as much as you can. Wear a mask when interacting with anyone outside your household bubble, and only go to public places for essentials. Just because a store is open does not mean you should go to shop. The public health laboratory is running at full capacity, and we are processing record numbers of tests a day. The time for self-referral to booking appointment is 72 hours. However, we expect this to go down to 48 hours by end of day today. The time to receive your results after you have had your swab is 36 to 48 hours. We have a significant number of individuals to contact in order to notify them that they have been a close contact of a confirmed case. If you have any reason to believe that you may have been exposed but have not yet received a call from public health, please stay home and monitor for symptoms. This would include anyone who has been notified through a team, association, school, or daycare. Widespread testing and strict adherence to self-isolation are the 2 key ways of combating this outbreak. I cannot stress enough the importance of adhering to self-isolation and public health requirements. We need to go hard and go home. If everyone can abide by these rules and restrictions, we have a shot at coming out of these restrictions faster. If cases continue to spread, it will prolong moving out of alert level 5. The variant is a complete game changer. It is far more transmissible than the original COVID strain. Even brief interaction can result in spreading the virus, and in many cases, there is asymptomatic spread. You cannot assume you do not have the virus. Our key concern right now are residents living in long-term care homes. If the variant were to make its way into a seniors' residential facility, it would very likely have devastating consequences. That is why we have such tight restrictions on visitors in these homes. I believe that self-isolation requirements also bear repeating. For everyone in the province, you have to self-isolate if just one of the following apply. If you are symptomatic, if there is a positive case in your house, if you are waiting on a COVID test result, or if you have been identified as a close contact less than 14 days ago, even if you have had a negative test. Self-isolating means that you cannot leave your property, you cannot go for a walk or drive. You must have essentials delivered to your home. If you cannot isolate away from your family by yourself, everyone in the house must isolate. These requirements also apply to Canadian rotational workers returning to the province. If a worker has already been in contact with the family prior to the policy change and is now self-isolating away from the family, the rest of the family need to monitor for symptoms, but not self-isolate. If you are an essential worker or an employer of an essential worker traveling to the province, please note the employee must self-isolate at all times when not working. They must proceed directly to and from their residence and worksite and are not permitted to enter any establishments unless it is a requirement of the job. In these situations, the employee must take all precautions, including distancing from others and wearing a mask. As a recap for those who may have just joined us, we have 7 new confirmed cases since yesterday's media advisory, and the total number of cases in the province is 704. Before I close today, I want to acknowledge all the support that I have received from across the province. I am so very appreciative and honored, and it lifts the spirits of our team to know that the province is behind them. If you feel inclined to show support with a gift, and you have the means to do so, please give to your local food bank, and not to me personally. While I am very appreciative, but there are people in our province who are struggling to access food right now, and helping your neighbours is the best way you can show your gratitude. To find a food bank or program in your area, please visit foodfirstnl.ca/database. As a reminder, food banks and meal programs can remain open in Alert Level 5 while adhering to public health guidelines, which can be found on our website under Community Food Programs. And above all, please be kind to one another. We are all in this, we are all impacted by this, and we will only see our way through this together. So hold fast, Newfoundland and Labrador. Thank you.
Well, thank you, Dr. Fitzgerald. I think I speak for the whole province and say that we are very grateful to you and your team. So thank you for that. With these latest numbers, and now with the first person in hospital because of this new outbreak, I can't stress enough how important it is to listen to all the advice of Dr. Fitzgerald and her team. When she says, stay in your bubble, stay in your bubble. When she says, always wear a mask and wash your hands, she means everyone. That includes you, everyone. And when she says to be kind, then please, please be kind to your neighbors. Take care of your mental health and reach out if you are struggling in any way, shape, or form. We know these are anxious times for you and your family, but please, you're not alone. Reach out. So remember, you are not alone in this. We will get through this together, but it means all of us working together, trying together. Reach out virtually to those that you may think need some support or just a shoulder, a virtual shoulder to lean on. We will get through this, Newfoundland and Labrador, but we need to do it together. With that, I'll turn it over to Dr. Haggie for some brief comments.
Thank you very much, Premier. I think, the numbers of confirmed cases may look low, but based on how the rapid testing is performing, it is highly likely that we will see from today at least 28 new confirmed cases. I think to follow a thread of previous speakers, I've had many calls to my office expressing thanks to both Dr. Fitzgerald and her team, but also particularly to the folk in Mount Pearl Square and the new testing site in Mount Pearl who have dealt with inclement weather. Their work has been very much appreciated, and I want to use this venue just to pass that along to them because it will help lift their spirits, I'm sure. Dr. Fitzgerald referenced that there are several unlinked chains of the virus within the province. We've announced new cases in all of the island's healthcare regions. So this is, once again, not a townie virus. You have to assume that the person over the street from you or in the store next to you when you have to go and pick up groceries actually has the virus and act accordingly. We have seen a significant increase in testing numbers, and Eastern Health and the Public Health Lab are to be congratulated for that, particularly at a time when we're also seeing increases in isolation requirements, particularly for healthcare workers. Premier referenced mental health. We've seen an increase in access to Bridge the Gap over the last week, and those resources, among others, are there for people. On the vaccine side, we normally update our figures on a Wednesday. Last week's figures show that of the vaccine delivered to the province, 83% of it has been administered. And as I say, we should have some new information within the next 48 hours. We need to use trusted sources for our information. Misinformation and rumor are out there and need to be addressed by trusted sources. I close by echoing really what Dr. Fitzgerald has said. We should only be spreading kindness. That's the only thing we should be spreading. So thank you very much, Premier, and I'll hand it back to yourself.
Well, thank you, Minister. I'll now turn it over to the media for questions.
Thank you, Premier. For the benefit of our speakers, there are 8 reporters registered for today's call. The question and answer session will be conducted in 2 rounds, where each reporter will have the opportunity to ask 1 question and 1 follow-up per round. Following this, I will ask each reporter if they have 1 final question. Our first questions are from Peter Cowan with CBC. Please go ahead.
Over the weekend, heard lots of reports of really long lineups for testing in Mount Pearl. People, some of them are taking up to 4 hours, even though they've got a booked appointment time. So I guess, first of all, why are we seeing these long lineups if these are supposed to be scheduled? And we're also hearing that some people are just getting fed up and leaving the lineup. So how worried are you that some people just aren't getting tested?
Well, first of all, if someone has a test scheduled, they absolutely need to get it done. So please be patient. We are setting up different sites to help with the backlog, and hopefully we can get that wait time down. It varies throughout the day as well, as you can imagine. So we're doing our best to set up another site. I don't know if you want to comment on that, Minister Haggie, as well?
Yes, certainly. I think some of the waits have been longer than we would like. A lot of that, I think, is down to traffic control and the like. We have also seen people turn up without appointments, expecting to get in. We do have a modest cancellation rate, around 90 to 100 folk a day at some sites, and we also have around 90 to 100 no-shows. Those are really disappointing because these are people who've been advised to get tested, should be tested, and that appointment now is no longer available for other people. The new site in Mount Pearl will add a capacity of around 1,750 additional tests per day to the 2,300 currently available at that site. And there are also several other sites in Metro. Public Health will direct you to the one which is most appropriate because we have been using different sites for different testing. We are working on getting those wait times down further, and if circumstances require, then more sites will be put online.
The overall message, though, Peter, is that these tests are so critically important. Please be patient, and especially with dealing with the hardworking folks who are running these posts. So just be patient. The test is incredibly important, so please get it done.
A lot of the people are coming forward because they may have one of those symptoms, not because they were necessarily exposed. And while they're waiting the 72 hours to get a call back, those symptoms go away. So can you just give us some clear guidance on what should people do if they haven't, it's not that they've been notified that they've been in exposure, but they just have symptoms and then they go away. Do they still need to get tested?
So certainly people need to sort of think about it a little bit, because sometimes people think their symptoms go away, but they just get a little bit milder. So if their symptoms are present at all, they should get tested. Sometimes, runny noses may start for reasons other than an infection, and, so you have to consider that. And so if people sort of have complete resolution of their symptoms without any further development of more symptoms or different symptoms, then they may not need to be tested. But certainly, it might be worthwhile to to reassess that with the online referral tool, just to make sure. And we I would never turn anyone away for a test. Let's just put it that way. So if you are concerned, you can still get a test.
Thanks.
Our next questions are from Elizabeth Witten with All Newfoundland Labrador. Please go ahead.
Thank you. Now that we have confirmation that at least one variant is here in the province, what's the priority of getting our own whole genome sequencing abilities up and running? And is it still expected to be operational in the next few days?
Certainly, we are working on that. The last I heard was that it was hopeful to be instituted by the end of this week. However, I haven't received an update today.
Thank you. And I'm curious, do you know how many tests it will be able to do in a day? And will it need someone specially trained to use the equipment?
Yes, there is a specially trained scientist that uses the equipment, and this is a special skill. And so that person is already there. That's the person who's actually in setting this stuff up. So it's, once everything is all set up and ready to go, we should be able to have that going. But with regard to the exact number of tests that can go through, I would have to get that information for you. I'm not sure.
Thank you.
Our next questions are from Peter Jackson with The Telegram. Please go ahead.
Hello. The daycare seems to be an issue with some people. There's a couple of our essential workers who have said their daycare won't take school-age children after 3 p.m., and it seems that this might be them interpreting instructions from the Department of Education. Can you clarify what the policy is on daycare?
Well, right now, there was an update on daycare this morning provided by Minister Osborne and the school district and the department. We recognize that there may be individual circumstances that fall outside the parameters of what was announced. And I encourage those individuals to reach out to the Department of Education, and after consultation with Public Health, we will do our best to rectify those individual situations, which we hope after today's announcement aren't that many, but we understand, as you suggested, that there will be some, and we'll do our best to rectify those.
Okay, it's just that last week it was made quite clear, I think, by Public Health that daycare should be reserved for essential workers. So that seems to go against what they're finding now.
No, I think the advice is still the same, correct,
Yes,
Dr. Fitzgerald?
no, the advice from Public Health would be that it should be for essential workers who have to, have to attend their place of work in order to be able to do their work. The reason for that is just the more people we have moving through a place, then the more concern there is for spread. And so we just want to reduce that risk as much as possible. If we have spread in a daycare, that takes out a daycare that can be there for essential workers. So we do have to be careful in that regard. So that was our advice, that it should be for people who absolutely need to have their children dropped off because they have to be out of their homes.
Okay. Well, hopefully the daycares understand that. Thank you.
Our next questions are from Kellyanne Roberts with NTV. Please go ahead.
Thank you. What is the protocol or the rules right now for unregulated childcare? Should they be open? Should they not be? Looking for some clarification.
For the unregulated? Was that the question?
Yes.
So the announcement this morning was around those who were using the operational grants. I'll get clarity with respect to the unregulated after discussing with Minister Osborne. I wouldn't want to lead anyone in the wrong direction just for 100% certainty. But again, it should be like sorry, Kellyanne. The guidelines are still the same, right? For essential, this should only be used for essential workers, correct, Dr. Fitzgerald?
Yes, yeah, and we don't whether they're regulated or unregulated, that doesn't sort of
yeah.
factor into our guidelines.
Right, so there's just a lot of the unregulated is through people's homes, like their day homes that are being used for childcare, and so there's questions when it comes to whether that influences the bubble or some essential workers use unregulated daycare, so if they can't use that, then they're going to overwhelm the regulated childcare. Just some confusion there right now.
Yeah, the department is working through exactly how many numbers are involved with respect to what we saw during the last lockdown. In respecting regulated and unregulated. So we, as you can appreciate, this is a rapidly evolving situation, and we'll update that once we have a definitive answer for you, which will hopefully be in short order.
Thank you.
Our next questions are from Josie Basque with Radio Canada. Please go ahead.
Thank you. It's now been a week since the first cases began to popping up. How concerned are you with the way the numbers of cases have gone up in the last 7 days?
How concerned am I?
Yes.
I'm very
we're all
concerned. I
very
locked down the
concerned.
province, so I think I'm really concerned.
And also, we received some messages from people kind of concerned about the time, how much time it takes to have to be contacted if there's a positive case around them. So what is the timeline exactly for those contacts to be contacted from the discovery of a positive case?
So I think it depends on the case and the priority level of the case. And again, that is an operational issue within, or not issue, but an operational question really within Eastern Health. And I don't have that information.
Anecdotally, I can tell you, from some stories I've been hearing that if people have availed of, if they use the rapid test, if it's positive, they've often been notified within an hour
Yes.
of the test.
It's been my understanding that any backlog that was there in a delay has been met, and they are fairly current. But I can't give you an exact time that it would take to get back. Yeah.
But just to be clear, just because you don't get a call within an hour doesn't mean that your test is negative. It's that's why we're using the rapid tests, correct, Dr. Fitzgerald?
Yes,
just to try to quickly grab those who are positive.
Thank you. Our next questions are from Jason Piercy with Rogers Communications. Please go ahead.
Yes, hello, thank you. Dr. Fitzgerald, you mentioned earlier that it isn't the number of confirmed cases that you report every day that startles you or scares you. It's the number that you don't know about. So it's very clear right now we are full-on hunting for every case of COVID-19 that we can find. And knowing that that is the case, and knowing how quickly this new variant is transmitted and how easily, does it actually worry you when we don't have more cases in some ways? Are you worried that we're not finding them?
I'm always worried about that. So yes, absolutely.
And a lot of decisions that have been made recently have been, I guess, in no other way to describe it than just full-on breakneck speed. Is there a point when you're trying to decide, like when we went to alert level 5, I guess it's prudent to always err on the side of stringency. So has there been a decision where you were kind of like, well, maybe not, and just always go to protecting the province? Like, have there been close calls in your process?
So, we've looked at this, having a contingency for what would make us go back to an alert level 5. Obviously, widespread community transmission is an obvious one, right? And now, since the variants came on the scene, we certainly have had those conversations far more. So, as a public health team at the provincial level, we certainly knew what it would take to get us to make the decision that we had. So there really wasn't much discussion needed once we found out this was the variant. There really wasn't much discussion needed to know what we had to do. Those decisions had already been pretty much made for.
Okay, thank you.
But we have some of the best hunters in the world here in Newfoundland and Labrador, and Dr. Fitzgerald and her team are certainly some of the best.
Our next questions are from Aaron Anderson with Globe and Mail. Please go ahead.
Yes, hello. Thank you. My first question is for Dr. Fitzgerald. The rest of the country is in the process of loosening restrictions, especially here in Ontario. And I'm just wondering what lessons you think the Newfoundland experience with the variant should be giving to all of Canada.
So I think people really should be watching our situation closely and see how quickly this can spread through a community. We don't think this was in our province for a short while and spread very quickly. We had a weekend where there were a few sports teams that got together. The number of cases that arose out of that was quite significant. But these conversations are happening across the country, and I think everybody, certainly in public health, are aware of the issues with these variants. So I think that the public health advice is not really varying very much in any of the provinces. So
thank you. Premier and Minister Haggie, could you speak about any conversations you've had with your counterparts across the country and what your message would be to them?
Sure. Well, I've, of course, spoken with the Prime Minister and have many texts from many premiers, especially here in Atlantic Canada, and the message has been one of full support for whatever we need and whatever capacity we need. They are all watching us and how we respond to this variant, and all have been supportive of the frank and decisive actions that have taken place so far in order to contain this. And I think Dr. Fitzgerald's absolutely right. I think everybody in other jurisdictions around the country should be looking and learning from us and where we're going right now with respect to how fast this variant can spread and how it can cause epidemiological curves that weren't predicted necessarily months ago. But all the other premiers have been supportive, the ones that I've heard from, which are many, and the Prime Minister and the ministers of the Crown, federal Crown, have been incredibly supportive in offering their support as well.
Our next questions are from Brian Callahan with VOCM. Please go ahead.
Thank you. It was mentioned off the top there how careful we have to be with long-term care homes and personal care homes and the like, the most vulnerable. Are there situations where masks are not required in these facilities? Because we're getting pretty legitimate reports of no mask wearing going on.
no. Everybody going into a long-term care facility should be wearing a mask.
Perfect. Thanks for that clarification. And with regard to this variant, has the source been found in your tracking? Or if not, how's that going? Or will we ever know where the source of this variant came in? And are you a bit apprehensive about finding that person and whether or not the backlash that might come with that?
So we haven't identified a source for this latest outbreak, and unfortunately, that may be a little bit of time coming because public health right now is just caught up with trying to contact trace and test and isolate people and do that very important work to make sure that there's no onward transmission. That is why we put in our public health measures with these strict restrictions that we have with. So that we can allow public health to do their work and reduce the risk of spread as much as possible. Once we sort of have moved through this and are on the downside of it, then we may be able to sort of sit down and have a really good look at the epidemiology and look back and make sure that we can identify that source. But at this point, the work that we have to do every day does not depend on us identifying that source.
Thank you.
Our next questions are from Peter Cowan with CBC. Please go ahead.
Dr. Fitzgerald, is there any indication right now that any rules were broken that led to this variant either being introduced or allowing it to spread?
No, not at this point. Certainly we know that, very robust social lives were contributing to the spread, but that's the case everywhere. That's not any different than any other place across the country. So we're seeing the same things that they've seen. It's just this variant was so much more efficient at spreading. So that's why we're seeing what we're seeing right now.
The federal government has embraced entry testing. Now anyone coming into Canada needs to be tested at least twice before they arrive and then once before they begin their isolation. So Dr. Fitzgerald, I'm wondering if you can kind of square the circle here. If we know from the research that this would catch about 70% of the cases, doesn't that mean that there would have been a 70% chance that the person who brought the variant into the province would have been detected at that point?
So I'm not sure of the timing with regard to when those rules were brought in and when the variant would have entered the province. So I really I don't know that I could answer that question, Peter. Sorry.
Sorry, I was meaning bringing in entry testing for Newfoundland and Labrador.
No, it wouldn't necessarily have meant we would have caught that. You know, we have lots of people who test positive after 7 days. There's no guarantee that this would have been caught by entry testing.
Which is why it's so important the quarantine is the best defense,
Absolutely.
right? That's why we never changed really the quarantine from when we removed from the bubble.
Our next questions are from Elizabeth Whitten with All Newfoundland Labrador. Please go ahead.
Thank you. Prior to this surge, there was the initial 5-person cluster announced kind of in late January, if we can all cast our minds back that far. I'd like to know if they were tested for the new variant, or was that cluster completely separate from this?
So they were not. They were a different variant, that cluster was, so not at all related.
Excellent. And since the province went into lockdown on Friday, or, the restrictions started coming in, sometime mid last week, I'd like to know how busy has the business response team been, and what's the team's current staffing level?
Sorry, could you repeat that question?
Oh, yes, sure. Since the province went into lockdown, I'd like to know how busy the business response team has been. They were created, I think, back in May to answer business community concerns about how the restrictions impact.
Of course, yeah. Well, they're still in place, is my understanding. I haven't spoken with them individually, so as to how busy they are, I'm not sure. But we are here to help local businesses in any way we can. So that people should be rest assured that we'll do our best to help everybody.
Right. Just to follow up on that, I've been hearing a lot of business owners, and they don't always know the regulations or how these new restrictions are going to impact them.
So the regulations with respect to lockdown level 5, Dr. Fitzgerald has stated them. They're on the website. So I think the best thing, if you're kind of curious about the restrictions of the lockdown level, is to consult the website. Would be best. Wouldn't you say, Dr. Fitzgerald?
Yeah, certainly the information is available on the website. Much of it is the same as what it was last year. So for businesses who went through this last time around, it would be very similar. There's certainly that, and I think most know how to reach out to the business response team if they need to.
Thank you.
Our next questions are from Peter Jackson with The Telegram. Please go ahead.
There's a Bell Island resident says the Department of Transportation won't allow passengers to leave the island starting tomorrow unless they have a letter from their employer stating they are an essential worker. Is this part of the new government policy now?
Minister Haggie, perhaps that when you were speaking with people from Bell Island?
My understanding is that is a Transport Canada issue once again. I have been in discussions with Minister Bragg about what their ability to influence those kind of decisions is. But once you step foot on the boat, jurisdiction passes from the province to Transport Canada. And I know we've had challenges with that in the past. I haven't yet heard back from the minister that there's been a resolution to that.
Okay. Thank you. Also, Ontario has said it may start vaccinating seniors outside of personal care as early as March. Given the expected uptick of Pfizer shipments to the province, when can we start seeing some estimates beyond the first quarter?
Minister Haggie?
Yeah, sure. Thank you very much, Premier. The bottom line is we only know for sure what vaccine doses we can count on for February. We have doses allocated for planning purposes beyond that. Our challenge at the moment is we still have been able to vaccinate less folks than we would have liked to, simply because we don't have the vaccine to give. And to be fair to the federal government, they don't have it to give us either. Certainly, once the phase 1 vaccines have all been administered, and the target is still for the end of quarter 1, which would take us into March, we would then move on to phase 2, which, according to the NACI guidelines, would then involve seniors living in the community, particularly the very elderly and the very frail. How we do that will depend on the rate at which vaccine arrives. We have 27% of our population who are over 65, and probably maybe a third of those are over 85. So we have to start with the elderly, the really elderly, and work our way back. We can do this. We've done it before. We just simply need the vaccine.
Thank you.
Our next questions are from Kellyanne Roberts with NTV. Please go ahead.
Thank you. Are we aware of any cases right now in long-term care homes, knowing that Pleasant View Towers, all their residents and staff have been tested over the weekend?
No, we're not aware of any cases in residents of long-term care homes in the province.
Thank you. And I'm just looking for some further clarification. Peter Jackson had previously asked this question, but a lot of childcare right now is saying that they will not be taking kids after 2 p.m. or 3 p.m. because that's when after-school programs will kick in for essential workers. So we're saying that that shouldn't be the case at this point, right? That child care should be available past that point in time?
Yeah, we're working through all different options to find solutions for people with different schedules. We're obviously moving as fast as we can to ensure that essential workers in particular, essential workers are the only ones who should be using this right now, we can provide the services they need for childcare. But we don't have every solution available at this particular second, but we're working through it.
Thank you. Is there any estimated when we can expect an update on that?
I know Minister Osborne and his team are working diligently, so hopefully have some clarity on the unregulated portion and time frames shortly, hopefully within the next 24 hours.
Thank you.
Our next questions are from Josie Basque with Radio Canada. Please go ahead.
Thank you. We mentioned earlier we were talking about the rapid test, the regular test. What are the criteria for using a rapid test or a regular test? Even we've heard so much about it. And do we have enough tests for the capacity for the numbers of tests we're doing every day?
Yes, we have enough rapid tests to do what we need to do. We are applying, so there are certain groups, high-risk contacts that we certainly want to have, excuse me, we want to have what we call a PCR test, which is the regular test that we do at the lab, and that is very important. We want that result as quickly as we can. So the presumptive tests that we're doing are for people who are in a slightly lower risk category, and they are being, and we're also using them in situations like at personal care homes if we're concerned, or long-term care if we're concerned about cases there, so that we can get in and very rapidly test, a lot of people in a short period of time. All of those tests will go on for confirmation, and so that may take a little bit longer. So it's really about the priority of the case or the potential case and how quickly we need to find out that answer. But we do present, we do treat a positive rapid test as as we would a confirmed case with a PCR test.
And speaking about this, do we have more capacity now that we are in alert level 5 and many university PCR labs could likely be shut down? Maybe is that?
Sorry, was the question
I
that
can
was...
certainly speak.
Okay, go ahead,
Sorry,
Minister.
Premier.
No, you go ahead. I didn't hear the
No,
question.
I can certainly speak to capacity. I mean, in terms of the rapid tests, we've got over 130,000 of those immediately on hand. At least we had on Friday. With regard to the laboratory capacity, again, I have to shout out to Eastern Health. Our notional capacity maximum is 2,300 a day, and I think at the peak over the weekend we hit 2,800 in one 24-hour period. We do have a new machine coming online for PCRs, and it should be operational within the next few days, and that will increase our capacity by around 30%, 35%. In terms of access, we also have an arrangement with the federal government for what we call surge capacity testing, where if we needed to, we can send out PCRs to the federal laboratory in Moncton, who would do those on our behalf. We reckon all routes in by the end of next week or the beginning of the week after, we will have the capacity to test 7,000 samples per day.
Thank you.
Our next questions are from Jason Piercy with Rogers Communications. Please go ahead.
Yes. Mr. Premier, you mentioned that local businesses would have your full support, which is wonderful news. Small business feeds a lot of families here locally. I'm wondering, I suppose it's a two-part thing, is any of that support planned to be financial, either in relief or in direct assistance? And that would obviously have to come if we continued in a lockdown. And if it is the case, how long would we have to be shut down before small business owners would start to wonder whether or not they would have assistance?
Sure. Yeah. I mean, first of all, we don't know how long we're going to be locked down right now, and I think it would be dangerous and irresponsible to try to predict with any certainty that timeline. But I can imagine that support would be similar to the past lockdown maneuvers that government has used. And so, you know, this is early days, and these are all things that are being worked on actively and aggressively by government officials to ensure that we're protecting from a public health perspective, but also we recognize the stress and strain on businesses as well.
Okay, I can see that obviously it would take time to put something like that in place, even if it had already existed. I'm not so much wondering how long you expect to be in lockdown, but if somebody is home wondering when they get to open up again and they're concerned for their family, would there be a projected timeline onto if we were to remain locked down, they could start to see the government put assistance in place?
Yeah, it's just too early to tell that kind of with any kind of definitive promise for anybody at this particular moment.
Okay, I appreciate it. Thank you.
Yep.
Our next questions are from Erin Anderson with the Globe and Mail. Please go ahead.
Thank you. We know with the variants how important contact tracing is, and I was wondering if you could tell me if you're doing anything differently in terms of contact tracing because of the variant, sort of the breadth of the contact tracing. Are people coming forward and volunteering that they had contact? Are you doing forward and backward contact tracing? Just kind of a general sense of where you are on that front.
So certainly with the variant, and these are conversations that are happening not just here, but everywhere, really right across the country right now. When we have the variant, how much contact tracing do we do, and does it change, and who are considered contacts? Certainly one of the things right now that we are doing that we perhaps didn't do with the original strain was that anyone who has been in contact without a mask, who's been around someone, they're considered a contact. And so that's significant. This virus is actually quite efficient at spreading. So whereas previously we may not have considered all work contacts say on a floor in a building or in one area of a building to be contacts if people didn't have really close contact with them. We wouldn't necessarily have considered them all to be contacts, but now we would if there were brief conversations, those sorts of things. We would certainly consider those exposures to be significant with this variant. Not saying that, walking past someone in the hall or anything like that would necessarily put you at higher risk, but certainly, a brief conversation, especially if you weren't wearing a mask, would be considered significant where it might not have been before.
I'm not sure if we're going to go to a final round of questions, so I'll hold off on my other contact tracing for that. But I was hoping that maybe you could just weigh in. Like, I know, being from the East Coast myself, you guys have done an excellent job at suppressing the virus. Now, in the last 2 weeks, you've had, almost the same number of cases as 2020. Can you speak a bit to just emotionally what that feels like? How Newfoundland is doing with kind of just the turn of events in the last few weeks?
So I think this is a testament to COVID and how we need to be vigilant. I mean, we had, as I've been constantly reminded, the strictest border control measures of any province in the country, and strict quarantine, and even with all of that, even with all of our public health measures that we've had in place, this variant of this virus still managed to get in here, and it still managed to find this place and to spread very efficiently. So I think, this is just a testament to why you can never let your guard down with this virus. And I would send out that message to anyone who is within hearing range of me right now. You really cannot. It does not matter how low your case count is today, because tomorrow could be a very different story. We had 6 active cases Friday before last, and look where we are now. So, this virus has to be taken seriously.
Thank you.
Our next questions are from Brian Callahan with VOCM. Please go ahead.
Thank you. With regard to the single hospitalization now, can you elaborate at all either on the age category, not necessarily the exact age, or the gender, or which region this person is in?
So given that it's one person, I'm not comfortable sharing any kind of information that could potentially lead to the identity of that person. So
I guess, would you agree that it could be somewhat of a wake-up call for people, just, again, a bit of a reality check?
Well, we know that there is a certain percentage of people who end up being hospitalized with this virus. It's inevitable. So you see enough cases, you're going to see hospitalizations. That is the sad facts of the matter.
And just as a quick follow-up, regarding foster care and children in foster care, we've had a couple of messages asking about their unique situation. A person saying that if they're supposed to stay within their own household bubble, how come, quote, we still have to take our foster kids to their visits? What would you say about that?
So I think that, there has to be consideration for children in these situations. It's a little bit, it's quite different compared to most of us, in the same way that, custody agreements we don't intend to interfere with. So I think there are some situations where we have to make sure that there are certain relationships that are maintained for the well-being of the child, and so that is important. So I believe there has been process put in place so that those things can happen safely, and any consultation that has had to happen, I believe, has happened.
Thank you.
I will now go back through each reporter to see if you have one final question. Peter Cowan with CBC, do you have a final question?
Thanks, Leslie. I do. Dr. Fitzgerald, you were talking about how people are finding ways to honor you and sending you messages. We've seen 18,000 people sign a petition asking for the new core science building at Memorial University to be named after you. I want to get your perspective on what you think of that idea, as well as the Premier's perspective.
I'll weigh in first. I think it's a brilliant idea.
I'm very flattered that people think of me that way, but I'm sure there are many, many scientists from Newfoundland and Labrador who deserve to have their name on that building way more than I do, who contributed significantly to the scientific community. And, in Newfoundland and Labrador. And I would, while I do appreciate everyone's support and thought in that regard, you know, I'm not sure that.
Does have a nice ring to it, though. Fitzgerald Science Building. I think it's great.
So anyway, that's where I am with it.
Thanks.
Elizabeth Whitten with All Newfoundland and Labrador. Do you have a final question?
Yes, I do. Minister, are there any updates on the number of healthcare workers impacted by the virus? I think on Friday afternoon you said about 300 people were self-isolating. Has that number changed?
Yes, it has. By breakdown, we have 403 in Eastern, we have 48 in Central, 36 in Western, 10 in Labrador, Grenfell, for a total of 512 as of around 10 o'clock this morning.
Thank you.
Peter Jackson with the Telegram. Do you have a final question?
I'd just like to get just a little more clarity on entry-level testing. We're still getting a dull bore of demand for this point-of-entry testing. And I want to, can you clarify again, as you did, I believe, last fall, why this would not change the circumstances in the province?
So why having the variant here now wouldn't change?
No, why point-of-entry testing would not change any of the policies or situations in the province.
So, I mean, right now, you know, isolation is quite important. We know that people can test negative on point of entry. At this point in time, we need to focus all of our testing on anyone who is a contact or has had a potential exposure to this variant. We need to make sure that anyone who's symptomatic is getting tested. So that's where our testing has to focus. So if we spend time doing testing on point of entry or people who are coming into this province when we're already asking them to isolate, you know, I'm not sure that would be the best use of our testing resources at this time.
Thank you.
Kellyanne Roberts with NTV. Do you have a final question?
Yes. When it comes to rotational workers, we've had a lot of people asking for clarification around the self-isolation, as it was noted in a Friday or Saturday's briefing that to self-isolate away from family. If your family's willing to self-isolate with you, is it okay to therefore then self-isolate with them?
Yeah, if you're not able to self-isolate away from your family, then you have to all self-isolate. So everybody would have to stay at home and not leave their property.
Thank you.
Josie Bask from Radio Canada. Do you have a final question?
Yes, I do. Thank you. For Mr. Furey, with the presence of the new variant and the alert right now, what are you telling your party candidates, and how did your campaign change in terms of staying safe during this election?
Well, thanks for the question. This is supposed to be surrounding public health and not electioneering. So, you know, as we suggested early on in the campaign, for everyone to do is follow public health guidelines, which is, I assume, all parties are doing with respect.
Jason Piercy from Rogers Communications. Do you have a final question?
Yes, I do. Thank you. The concept of the potential catastrophic changes to people's mental health while in isolation has been discussed a bunch of times, and I think that's really important. Advice has been given, a list of people and places that you can call and hotlines, and all of that stuff is really, really wonderful. But with anybody who has lived experience, there's an inherent flaw in the advice, given that if you are in a mental health crisis, oftentimes you don't have the strength to work out, to reach out to somebody for assistance. So I'm wondering if there is, or what advice you could give to those of us who have loved ones who we know need help, but don't have the strength to reach out themselves.
Well, that's where we're really encouraging families and friends and neighbors to reach out virtually and encourage those people to get the help that they require through the resources available. I'm sure all three of us could speak on this topic, but as you suggest, there's no degrees of separation when it comes to mental health and addictions, and an issue like a COVID outbreak heightens all of those, of course. And That's why we really encourage you to reach out to people who you know who may be alone, who may be suffering, who have had problems and suffered in the past, or even who you think may be who have new mental health and addictions issues. Reach out to them and encourage them to get the support that they need, and they will get through this, and there are tools available to them. And you, everyone at home, can be a mental health provider in that respect.
Thank you very much.
Erin Anderson with the Globe and Mail. Do you have a final question?
Yes, I do. Thank you. Dr. Fitzgerald, so you mentioned that you've raised the standard for contact tracing, especially in the workplace. It sounds like you've increased the rules on isolation, where if you can't isolate from your family, you can't isolate in a separate room. The whole family in that house would have to self-isolate. Are there any other variant-specific measures that you think we need to start looking at based on what's been happening in Newfoundland?
So we are having those discussions now as to what other things may need to change, and so if there are any changes, I suspect they'll be coming in the next few days. I wouldn't want to comment on them
prematurely. May I just ask a quick follow-up? Do you mean discussions with other public health officers across the country, or just within Newfoundland? Within our teams here, we're having discussions about how we need to approach contact tracing in this regard. But I wouldn't want to speak prematurely about what's going out. There's still some discussion happening. So. Okay. Thank you.
Brian Callahan with BOCM. Do you have a final question?
Yes, thanks. Dr. Haggie, you just mentioned that there are now more than 500 healthcare workers in isolation. What percentage of the entire workforce does that represent, and to what extent is it affecting services or even testing, albeit reduced, the services there, either at the hospitals or other healthcare facilities?
I'll answer the second part of that question first, Brian, simply because I don't have the exact denominator for how many people are currently working in healthcare as a snapshot, and I can get that for you. From the point of view of service impact, it has been a real challenge, and Eastern Health have risen to it to reallocate staff to catch those 400 gaps. They have still managed to provide the maximum testing capacity that we have for the sites that we have currently at the moment. So there isn't a gap between testing ability and resources and the sites that we have, or the machines that we have to do it. In terms of acute care services, they are actually slowly ramping down. We've had a 10% reduction in bed occupancy in the last 2 days alone, as elective planned procedures are deferred and physicians triage their admissions. Obviously, emergency work, cancer care, chemotherapy, those kind of things, obstetrics will continue as before without any significant impact. We did it the last time, and we can do that again. So at the moment, there is no impact at the front end, given the fact the adjustments to workflow have been made.
And just as far as workers go, there's a lot of talk of the stress and strain on healthcare workers, whether nurses or whatever. So can you just briefly speak to that?
Yes, certainly. One of the things we did last time was make sure that doorways, our drop-in service, was regarded as an emergency service. People with lived experience are available to speak to members of the general public and anyone over the warm line or the mental health crisis line. And virtual consultations, of course, can continue. Each of the regional health authorities has its own employee and family assistance program, and there will be site and region-specific supports in addition locally. It is a challenge. The healthcare workers have borne the brunt of this throughout the both waves and the little fluctuations in between. And quite frankly, this is a marathon which has now turned into a marathon with no clear finish line, as well as one with hurdles. And so it certainly is a challenge. And if any of those staff have ideas as to how we can help that we're happy to hear it. And we do have regular meetings with the union representatives virtually to see what their thoughts on the issue are. So we're doing what we can. Is it perfect? Probably not. but we're always open to suggestions for improvement.
Thank you, sir.
Thank you, everyone. Premier, do you have any final comments today?
Thank you all for joining us, and as we all collectively try to do our part to take control of this recent outbreak, we must take to heart the lessons we've learned from the past, and following the rules works. So be vigilant with the rules. Follow Dr. Fitzgerald and her team's advice. And I just want to, you probably can't see, but her mug here says something that's fairly profound, and I think it's really important. In a world where you can be anything, be kind. And I think that's a good message to end on today. Thank you very much.
Thank you, Premier. Stay safe, everyone. Take care of yourselves and each other, and enjoy the rest of your day.